How well are you looking after your teeth? Chances are not that well. About 90% of us have at least one cavity, nearly half of us will have gum disease by the time we're 30, and this is all a slippery slope to tooth loss, oral cancer, and way worse. And if you want any other reason to get on top of your dental hygiene, bad oral health has been linked to some of the worst illnesses you can get, from heart disease to Alzheimer's and diabetes. I'm Dr. Karan, an NHS surgeon, and in this podcast, we cut through the BS of modern health advice and tackle the biggest issues in science and medicine. I really wanted to do an episode on teeth and finding the perfect oral hygiene routine, but finding the right person to discuss this with me was tough. There's a lot of nonsense out there, but I finally found Whitney DiFoggio, aka TeethTalkGirl, a dental hygienist who shares evidence-based dental advice online. In this episode, we cover all the fundamentals like flossing, mouthwash, and the perfect brushing routine, but we also discuss things like tongue scraping, charcoal whitening, water flossing, tree bark toothbrushes, and tonsil stones. But let's start with good old-fashioned brushing. How often do you actually need to brush?
I think that's a great point to bring up because so many people ask me questions similar to that. Like, what is the answer? What should I do? And it's so interesting because it really is based upon the individual. Every person is different. Dentistry is not a one size fits all. Like I have kids that'll come in, a family of 5, and every kid has a slightly different thing going on and they need to do slightly different things at home. So, but long story short, my answer would be evidence-based answer is ask your individual dental provider, right? If you don't have an individual dental provider, you're unable to go to the dentist or see a hygienist. The general advice, you can't go wrong with brushing once in the morning and once at night. That's at least 2 times a day. The wording for the American Dental Association, at least, is at least 2 times a day. So we always say 2 times a day, but it's really at least 2 times. So you can't go wrong if you brush after every meal. There is some evidence to show you should wait 30 minutes before you brush after eating. Before bed is the most optimal time for brushing, right? Because you're about to sleep for however long you sleep, and that's when all the microbes and everyone in your mouth likes to have a party, right? The bacteria, when it's a dark, wet, moist place. And at least cleaning between your teeth at least once a day. That's what the American Dental Association has right now. I'm not sure what other countries have for flossing or cleaning between your teeth, but at least once a day. The evidence-based part of that is it takes about 24 hours on average. Everyone's different. It takes about 24 hours for plaque bacteria to harden into tartar or calculus. So plaque is the sticky stuff you can brush and floss off. Tartar, calculus, that's that stuff that's really hardened and mineralized. That won't come off with a toothbrush or floss. So our goal is to disrupt that plaque, that biofilm layer with a manual toothbrush or an electric toothbrush or floss at least once a day within 24 hours, and then you're good. Some people need to floss twice a day. Some people, that happens fast. They have either a very acidic mouth or there's so many things. Some people I will tell, you got to be flossing twice. But most people at least once disrupt that biofilm. If someone tells you otherwise, then listen to them because they know your individual mouth best.
So again, apart from those recommendations about number of times, there's also discrepancies and variabilities about the total number of time you should spend brushing your teeth. Again, the standard seems to be around 2 minutes. And I guess the main purpose of this is getting rid of that biofilm, that kind of jelly-like sheet of bacteria and microbes, and any sort of, plaque, disrupting any plaque that might be there, and generally getting rid of any food debris as well. And that 2 minutes, I guess, again, for me, you might be able to tell me where this arbitrary number has come from. But again, surely there might be some variation here as well. Someone who wears braces may need to brush for longer than 2 minutes. Someone who has chronic hygiene issues also may need to brush longer than 2 minutes. And I guess if someone is super efficient, they might be able to get away with 90 seconds maybe. So I guess some variability there as well.
Yes, good point. So the 2 minutes, again, it's at least 2 minutes. So for most people, 2 minutes is the science they did, the research they did is that's what an average person would take to clean every single tooth surface in their mouth, right? The fronts, the backs, the chewing surfaces, all the little crevices should take around 2 minutes. However, like you said, orthodontic patients, patients in braces, some elderly patients who have bad dexterity, poor dexterity that are struggling with doing a good job, they might need to take a little longer, right? Because they can't do the motions properly. That's when we start talking about electric toothbrushes because they help do the work for you, right? Technically, a regular toothbrush and an electric toothbrush can give you similar results if used correctly, but user error is the number one issue, right? So finding what works for you best and then kind of figuring out how long it should take. Again, I do believe from what everything I've read, everyone should at least do 2 minutes. Another thing to your point, if anyone wants to do less than 2 minutes, I hope you're brushing more than twice a day. Do you know what I mean? Like even it at some, so like I will brush in the morning, my morning brush. I'll brush before I eat breakfast. I'll also brush after I eat breakfast. My after I eat breakfast, that extra guy, I'm only doing a minute there because it's just a quick minute, right? Like I have to go to work. I'm busy. But then at night, I'm going to do the full 2 minutes, maybe more before bed because you need to get everything. So each time you brush throughout the day kind of depends on how often you brush. You know, if you're brushing after every meal, it doesn't have to be 2 minutes each time unless someone tells you otherwise. Are you struggling with gum disease? Do you have full out periodontal severe disease? Then maybe you do need 2 minutes each time. It really just depends on the person. I know that's not a good answer, but I hope that kind of helps people understand why there's so much different information out there with regarding that.
I think that's the best kind of answer because, as it comes to any facet of health, you can't really give blanket rules for anyone, whether it comes to sleep health or exercise or brain health or anything like that. And I guess we shouldn't hold dental health to any different standard. And I guess going further into this kind of deep dive of variability of different aspects of brushing, I maybe 5 years ago switched from a manual toothbrush to a electric toothbrush because I was actually going out with a dental hygienist at the time, and she suggested that I should get a electric toothbrush.
Yeah.
And she sold it to me because there's less pressure used on the gums and on the teeth. And because of the vibrations, you can actually disrupt any food debris that might be sort of hiding between the cracks, interdental debris. And I could also kind of clean my tongue with it. And it has different modes for cleaning your tongue, cleaning the gums, cleaning the teeth. So it made sense from that point of view because actually I found that I'm quite an aggressive brusher, and I was using probably too much pressure with my manual toothbrush. And occasionally, maybe I would see a little bit of blood because I was maybe being a bit too abrasive with the brush on my gums, potentially. Not all the time, but that was something that I noticed because I was sort of so vigorous trying to really scrub it clean. Is there any data which suggests that actually you can get a decreased incidence of gum disease and plaque and cavities by a cohort of people using electric toothbrushes versus manual toothbrushes? Do we have that information yet?
I've seen a lot of studies, but I haven't seen anything super strongly linked to that. However, it depends what we consider gum disease, because in some cases, like you said, with brushing aggressively, right, that can possibly, it's not one of the leading causes anymore. People used to think it was, but aggressive toothbrushing can cause gum recession where your gums recede, right? More research has shown it's really more poor oral hygiene is the number one versus aggressive toothbrushing, or clenching and grinding your teeth is another big one that we know causes gum recession. But aggressive toothbrushing can, if you already have gum recession, it can worsen it, right? And so I love how you mentioned like the pressure sensor on an electric toothbrush, 100% can help with someone who already has a heavy hand, because it'll alert you when you're pressing too hard with the toothbrush, so you won't make things worse. Gum disease and gum recession are related, right? And so I feel, yes, it can help, but we don't I would never say an electric toothbrush is a better toothbrush. It's going to do this, this, and this for you as a blanket statement either, just because you can do a very good job with a regular toothbrush if you use it right.
What are your thoughts on those more traditional natural brushes like the miswak brushes? People use them in Africa and Asia. It's a kind of like some sort of tree bark, which they use and just chew. Historically, that's what I guess some of the ancient Romans did and other tribes across Africa and Asia. That seems that it might be quite abrasive to the gum because it is tree bark, but also that type of tree bark is supposed to have some antimicrobial properties. And because it's naturally grown, it also contains natural amounts of fluoride as well, which is also beneficial for mineralization of the teeth.
I love that. So a lot of people have been requesting that I make a video on this, and I haven't
Yeah.
made it yet. So you're inspiring me to go make that video. But I haven't yet, just because I haven't read enough about it.
Yeah.
However, what I've seen is, and when patients one-on-one ask me at work, I always say, you know what, if you like it, use it, right? But I would still add in a regular brushing session with a regular traditional toothbrush that we use now, just to confirm, since I don't know enough to tell you it can replace, right? And I don't think many of us know enough yet, but it's been working, and I love that. And I never want to say don't do it just because we don't have enough research. That doesn't mean it's bad. It just means we don't know enough, peer-reviewed studies about it. But if people like it and they have good oral hygiene, and you're going to the dental office and they're telling you you're doing a good job, I'm all about it.
Something you mentioned, just a few minutes ago, that you brush before breakfast and after breakfast. And then you also mentioned that there should be baked in at least a 30-minute gap when you're brushing after breakfast. And I've heard something similar, 30, 60 minutes. Why is there that gap? Is it because of the acid from the food, which might impact kind of the acid balance in your mouth?
Exactly. So the acidic environment in your mouth, they say between 30 and 60 minutes. The research kind of shows that that's how long it takes for your saliva to kind of neutralize all the acids in your mouth. So when you're brushing, you're not like having weakened enamel that you're brushing on. So the enamel could be protected from your neutral saliva versus an acidic saliva. So some ways to get around that is chewing xylitol gum. The xylitol gum can help neutralize acids and kind of repel bacteria a little bit. Just swishing with water, with plain water, right? Water is neutral, pH 7. So I feel anything you could do to just kind of get that food or that drink, any drink other than water, off your teeth. If you're really eager to brush, just try to get a neutral environment in there.
I think the point you made about xylitol gum is really interesting because, from my point of view, it's a sugar alcohol, right? And similarly, sorbitol, it's similar, in sort of structure to xylitol. It's a sugar alcohol. It's a non-nutritive sweetener used as a sort of like a sweetener alternative, and it's actually really good for dental health, right? It inhibits the growth of certain harmful bacteria in your mouth and increase the production of saliva. And I think in terms of chewing gum, a lot of people don't like chewing gum because it may increase bloating and various other things. But actually for dental health, it's like I guess the closest thing to a dental wonder drug.
Yeah, there we go. We love that. Yeah, it comes, there's mints, there's xylitol mints, there's a bunch of different things you can try. Don't overdo it because, as we know, that's like out of my scope of practice, but I know you can overdo it with the xylitol. Like you said, it could give you some tummy issues some people go a little overboard because they put it in their coffee, or they're using xylitol in a bunch of different ways. So just watch out with your tummy, watch out with your dogs, because I know it's not good for dogs. But other than that, I love xylitol. I think it's a great addition to a lot of toothpastes as well. If it has fluoride in addition to xylitol, I think that's like a great combination for toothpaste because you're getting the best of both worlds. But yeah, that's always a fun fact to find more things that can help your dental health.
Yeah, definitely. And I guess if you are eating xylitol gum or mints, maybe try not to swallow them if you can, because it is a osmotic laxative. And while your teeth may be great, you might be spending a bit too much time on the toilet. And just to pick up on the point that you mentioned there about the toothpaste, I didn't actually know that you can get xylitol out of the toothpaste, which is interesting. If someone is looking at toothpaste, I mean, I guess you'll be able to tell me there's probably no difference between the generic cheap stuff and the branded amazing looking stuff, right? As long as it's got the right active ingredients. And what are those active ingredients if I were looking at getting kind of the most ideal toothpaste?
Sodium fluoride, stannous fluoride, sodium monofluorophosphate. I always say it has to have fluoride in it, right? And when people look, sometimes they don't see fluoride in there. And then they're like, but it just comes in all those different names. So we just have to know there's stannous fluoride, there's sodium fluoride. So those are my two favorites, stannous fluoride and sodium fluoride. The most research is done on those two. So that's number one. That's really all you need in a toothpaste. I always say you don't need all that fancy stuff, right? You don't need whitening. You don't need, if you want it, sure, but you don't need bad breath, whatever, protector. This is all marketing, advertising words. As long as it's anti-cavity, that's what we use toothpaste for, right? The brushing motion itself, with brushing with plain water or even dry brushing, that's going to help protect us against gum disease because we're stimulating the gum tissue. We're removing debris and plaque and all that stuff. You don't need toothpaste for that, really. Yes, toothpaste helps. Fluoride has a lot of benefits for gum health as well, but for cavity prevention without any fluoride, if you're someone who has an acidic environment in your mouth or you're more prone to cavities for whatever reason, without having that remineralization ingredient, you're going to just kind of not help yourself in that area. So I'm all about using fluoride. And if it is from the dollar store or I don't know, like from a discount store or a name brand, as long as it has the ingredient and it matches the name brand one, I always say just put them next to each other because I'll tell you too many percentages and no one will remember. So just put them next to each other, make sure they look about the same and you'll be fine.
When it comes to the point of fluoride, and you've probably seen this more than most, there's been this huge rise against fluoride, a huge movement against fluoride, even though we have countless amounts of research suggesting that the introduction of fluoride into water supplies and toothpaste has directly correlated and been a causative factor in reducing cavities and all sorts of dental related diseases. Why is there such like a sentiment against fluoride, certainly that we've seen in the last few years?
It's a combination of misinformation, conflicts of interest, cherry picking studies. I do feel a lot of people have their own agendas and they demonize fluoride to sell their own product. Unfortunately, that's what it kind of comes down to. I spent kind of 2 years studying that exact topic for school. And yeah, it's just, it makes me so sad, right? Because I see it firsthand with families that stop using fluoride and all their kids have so many cavities and need to get their teeth pulled at such young ages. It doesn't happen to everyone. Some people do not have the bacteria in their mouth that will give them cavities, right? But most people do. So I don't want to say that just because you remove fluoride means you're going to get cavities. That's not for everyone, but for many people it is. That's what cavities are multifactorial, right? There's so much that goes into getting a cavity. Right? There's diet, there's so many things, your saliva. But when it comes to toothpaste, it's one of the best preventative things we can do. And it's unfortunate that so many people have made it scary. Obviously, like anything, fluoride can be toxic at a certain dose, but we're not exposed to those doses in toothpaste or water. We're nowhere close. We're nowhere near where that level would be. So anything could be toxic at a certain dose. I always use the comparison of oxygen can be toxic. We can have oxygen toxicity. If there was too much oxygen right now, I wouldn't be able to breathe. So I try to help people understand that it sounds scary because they're like, fluoride's bad, but it's not. That's like saying oxygen's bad. Like it's just when it's at a certain dose, it's bad.
I totally agree. And I guess, it's one of those things where it's not even man-made. It's found in our natural environment. It's found in
100%.
rocks and soil and in the air that we breathe and in the water, whether it was actually added by governments or not, it's still present in the water regardless. So, as a natural substance, as natural as silicon dioxide, which is kind of, found in sand, you can't really get around it. And it's not harmful, like you said, unless you're consuming toxic doses. And if you were consuming toxic doses of fluoride, you would be probably, killed by a variety of other things well before the fluoride hits you.
Totally. You will have water toxicity drinking water way before the fluoride gets you. Your kidneys can't even handle. But on that same note, it's interesting how you said fluoride is natural. And I think this natural fallacy thing is happening online as well, where everyone thinks natural is better. And I don't know where the disconnect happened, where people forgot that fluoride is natural because so here's an interesting, I don't know, it's called nanohydroxyapatite. It's another toothpaste option. So everyone's saying it's natural because hydroxyapatite is in your teeth, right? It's in your enamel already. That is something in your enamel. However, I always kind of almost laugh because I'm confused when people call that natural because nanohydroxyapatite is not naturally occurring. Hydroxyapatite is, but we're making this in a lab. We're making it in a lab. Fluoride's made in a lab, obviously too, because we have to make toothpaste somewhere. But when people say nanohydroxyapatite, it's natural. I'm like, so is fluoride. I don't understand. They both are. Not that matters because poison ivy is natural too. And I don't want to be putting poison ivy on my, face. Anyway, but if anyone's listening that is really against fluoride still, it's your mouth and you get to choose what you want to do. I always do say, because I do have patients, right? I don't want to argue. I still want to make sure I can do give you the best recommendations on what you're willing to use, right? Even though fluoride is 100% safe, and that is what I recommend for toothpaste, nanohydroxyapatite, although it doesn't have FDA approval, there's not much regulation. That's why I would never say this really.
Yeah.
I would never promote it or publicly. This is really just for someone who's nervous about fluoride. Nanohydroxyapatite shows really, really good, promising evidence that it helps remineralize tooth enamel, but it does not do it as well as fluoride, right?
I guess there's another wave on social media, which I feel this probably has the most science behind it, even though people have sensationalized it a lot. It's kind of this whole idea about people shouldn't be using mouthwash if they don't need it, and particularly alcoholic mouthwash, because we are increasingly appreciating that, we have an oral microbiome, a kind of population of microbes in our mouths and in and around our teeth. And these can be affected by the things we eat, but also drugs and alcohol, obviously, which can disrupt the balance of these microbes in our mouth. And obviously, most mouthwashes have alcohol as, one of their components, and this can affect the oral microbiome, put it into dysbiosis or dysfunction, which can then lead to a number of things. We know a lot of the bacteria in our mouth are involved in the production of nitric oxide, which is beneficial in our body for controlling blood pressure. And there's even, I believe, some early evidence suggesting that chronic mouthwash use has been linked from a correlation point of view to increasing rates of colorectal cancers because of that disrupted oral microbiome, which is obviously the first part of the digestive tract. What are your thoughts on it?
Mm-hmm. So mouthwash, if you like it, we'll talk. If you don't like it and you think you're just adding a mouthwash because you need to, don't do it. You don't need a mouthwash. I only say this solely, all the stuff you said, all that aside, it's not going to make or break your oral hygiene routine. Swishing with a liquid, brushing, manually removing plaque from your teeth and debris with a toothbrush, with floss or a water flosser or a proxy brush, something to get between your teeth and the fronts and the backs and the tops and the bottoms is what you need. A mouthwash is just going to add maybe something if you need it. There's a lot of different types of mouthwash. So if someone likes mouthwash and they're like, uh-oh, Whitney, but I like mouthwash, I want to use it. That's fine. But talk, of course, with your individual provider to see what's best for you. But in general, there's anti-cavity mouthwashes and there's antiseptic mouthwashes. There's a million others, but those are the general two. And when you're using an anti-cavity, it usually has fluoride, which is great.
Okay.
I'm fine with that. I always say use alcohol-free because even the American Dental Association has said if you already have dry mouth, alcohol could further dry your mouth. They've never, I don't believe, fully said that alcohol causes dry mouth or anything like that. But if you already have dry mouth, it's going to make it worse. So I just think when you hear something like that, it can't hurt to just use alcohol free, right? Like, unless you really like the burn, I really don't think it's necessary. Now, if you really like the antiseptics because they taste better or whatever your reason is, that's fine. But that's where it gets more tricky because a lot of the stuff you said kind of comes into play with the antiseptics. There's a lot of different ingredients in there that can sometimes, unfortunately, make the mouth more acidic, which is like, wait, what? Didn't we just talk about how acidic environments kind of lead to cavities? They don't cause cavities, but they can. So I just say be more careful and cautious with the antiseptics. Really talk with a dental provider about that, what you should get. But I always say, don't overuse an antiseptic. I don't even say do it. I don't even like once a day. I like a few times a week if you really like it. But if someone's struggling with gum disease or gingivitis, or you're trying to make your gums better, you're in like this stage where you're really working to get your gums back to where they need to be, then that's when antiseptics really come in, right? They can help kill, you have extra bad bacteria in there. They can kill off some of the bad, but we don't want to kill off the good as well if you don't have that much bad.
What I find really interesting is that, for so long, as I mentioned at the start of this episode, we think about the mouth as like a different entity to the rest of the body, even though it's directly connected, right? It's connected to, your breathing. It's connected to the digestive system. It's connected to even, increasing, or it's linked to diseases and other conditions like, type 2 diabetes, dementia even. And a lot of that has to do with the role of the oral microbiome.
Yes.
I mean, I would say that the abundance of evidence we have right now is definitely more leaning towards the correlation rather than causation side. But we do know that, once you hit a critical point of hundreds and hundreds of studies looking at the oral microbiome and suggesting that some low-grade chronic inflammatory process happening in the mouth, either because of dysfunction of that microbiome, is then that inflammation is leaching to the rest of the body. Like, for example, I read a statistic that around 47% of people who are over the age of 30 have some early signs of periodontitis or periodontal disease. And, by the time someone's hitting the age of 65, around, 67% of people have that deep-seated gum disease. And often the early signs of that is nothing. It's asymptomatic. And, there's some of these harmful bacteria which are involved in that process, that disease process, are causing inflammation in the gum line. And obviously the gum's intricately connected to the vascular and blood supply. And so those kind of pro-inflammatory chemicals make their way throughout the body. And, it's like a roller coaster. It could stop at the brain. It could stop at the heart. It could stop at the kidneys. And then you can see how the increasing progression of all these chemicals traveling throughout the body may provide some negative inflammatory change everywhere. And that's why there's, I guess, that link to chronic disease, because we know chronic disease, the hallmark is inflammation. So if you've got inflammation in our mouth, that's then traveling throughout the body. We've seen poor oral health linked with neurodegeneration and Alzheimer's, chronic cardiovascular disease, type 2 diabetes. I believe they've even found that if you've got periodontitis, you are at higher risk of type 2 diabetes. And similarly, if you are diabetic, you're at higher risk of gum disease as well. It's like a sort of bi-directional relationship.
Yes.
And to just take this one step further, there's a certain type of bad bacteria found in the mouth, Fusobacterium. I believe they've even found evidence of Fusobacterium in colonic polyps, which are precancerous. So, building this body of evidence, how important the oral microbiome is for health, we really should be looking into that and taking care of that ecosystem we have in our mouth a little bit more.
Right. So the mouth is the gateway to the entire body. That's what, everything you just said, right? And it's not just about having a cute, pretty, cosmetically nice smile. There's a lot more to it. It really, really directly impacts your overall health on so many ways. Like you said, bidirectional. It's vice versa. This can cause this, and that can cause this. Going back to what you said about how many young people have signs of gum disease. So yeah, gum disease has different stages, and gingivitis is the first stage. And all gingivitis is inflammation of the gums, right? And so inflammation of the gums means if your gums bleed when you brush or floss, if you have any kind of puffiness, red, swollen, puffy. So a lot of people have that. And so, like you just said, it's a bummer because if the good thing about gingivitis is it is reversible. You can reverse it. But once you start getting bone loss and the teeth are losing tissue to hold them in, that's when we start getting into more severe periodontitis, periodontal disease, gum disease, whatever you want to call it. And once you have bone loss, there's not much going back, right? There are some surgeries you can do and different procedures. But when you get to this chronic level of bone loss, we just need to salvage what we can. And oftentimes that's when people lose teeth. And that doesn't help either when you don't have teeth. Now you can't chew chew nutritious as foods, and it all is connected. So it's kind of, I like how you said a roller coaster, because it is. It's a roller coaster. It's ups and downs. And now this bad bacteria in your gums is traveling throughout the entire body. I think the first studies we saw, at least for me, I saw a lot of many years back, but the gum disease and heart disease link, like that was like when that first came out, I was like, like I was still doing my undergrad and I was like, what's this about? And it makes so much sense. I mean, of course, things travel through your body and all that with gum disease to say, the same thing goes for cavities and tooth decay. If a cavity, which back to misinformation, a lot of people are not getting cavities filled lately because of misinformation online. They're saying swish with celery water and things I don't even know what's happening. But so cavities they don't get better on their own, right? Like there is something called incipient decay where if the cavity didn't pass through the enamel to the next layer yet, it might be able to be remineralized, this and that. It doesn't get tooth enamel doesn't regrow. We can't do that yet. Maybe one day soon. But when people just let things get too bad, the tooth decay, this tooth infection, it can spread right to your brain. So like we've seen this, we've seen people die from tooth infections. So I think whether it's your gums, whether it's your teeth, all of that's to say is yes, dental health is so important. And I'm so happy you're featuring dental health on this episode because so many people forget that that's something easy you can do to help reduce your chances of heart disease, reduce your chances of diabetes. I know all these other things we're told we need to exercise, we need to eat healthy, but this is such an easy thing. You just brush,
Very low-hanging fruit. Yeah. What struck me when I was sort of doing some research was, just the impact that tooth loss can have. And you mentioned the link between tooth loss and then maybe not being able to chew and masticate as effectively. Yes. And you might deprive yourself of nutritious food. Yeah. And I think, I can't remember the name of the researcher, but there was 35,000 participants in the US. Okay. And they looked at tooth loss in this population. And for every one tooth that was lost, there was an increased risk of cognitive decline by 1.7%. So cumulatively, if people are losing, if someone is losing one tooth because of bad dental health, chances are they will continue to lose more teeth. Mm-hmm. So cumulatively, if you go along that sort of risk calculation, there's probably a several percent increase in cognitive decline and dementia from tooth loss. Now, maybe that's because of the inflammation and the sort of bad oral hygiene. Mm-hmm. Also because they're depriving themselves of nutritional intake from their diets. Maybe even from a societal point of view, they don't feel they can go out as much because of their sort of self-perceived cosmetic effect. They're embarrassed and they isolate themselves, which we know isolation also can contribute to neurodegeneration and sort of, cognitive decline. So really, it's kind of like a triple whammy when you sort of fail to take care of your oral health and you start losing teeth. That's really kind of end of the line type stuff where it's almost getting to that irreversible stage then, isn't it?
Yes, that's the triple whammy. That's a good description because it's coming from all angles. It's like this falls down, then this falls down. Everything's falling down and it's tough. It's really tough to go back once you've had so much tooth loss. Like dentures are an option. There's different tooth replacement options, but it gets very pricey and very costly, at least in the US. And dental implants are a great tooth replacement, but to get to that point, it takes months to even kind of fix what happened. So yes, that's another reason why prevention, I feel, is so important because we can really prevent this stuff from simply brushing and flossing every single day. Routine, just getting it into your routine and really making it a habit that you just can't go to sleep without brushing, and you get motivated. I feel I have some patients that tell me like every 6 months they come see me and they're like, "Oh, Whitney, I'm so motivated. I'm going to be flossing." And then I see them in 6 months. They're like, "Yeah, I kind of fell off that after like a month of seeing you." It's hard to get into that routine, but once you do, you'll feel so much better that you did it. You really will start feeling better. Like you take care of yourself. It's not just cosmetic, it's mental. You feel like you're doing something really good for yourself, right? People feel so good when they exercise or work out. I think it's 40% of Americans only brush once a day.
Wow.
That's like
it's leaving money on the table.
I know. That's what I'm right. If we could all just brush twice starting, I know we talked at the beginning that everyone could brush different, but as a whole, if we all just really do that routine, 30 seconds of flossing, 2 minutes of brushing, whatever you can do, doing your best, it can really help your overall health.
Now, flossing seems to be a bit controversial because I guess there's an absence of evidence or high quality evidence that flossing makes a difference for oral health when compared to just brushing alone. But then I guess the caveat is that the absence of evidence doesn't mean evidence of absence. So, you have seen as a dental professional that flossing can have great impacts, compared to just brushing alone. I guess if you see the tooth as like this cuboid structure. It's got 5 sides, the top and then the 4 sides. So you kind of need to cover all of that. And with just brushing alone, you can't cover the 2 sides in the middle where it's kind of touching the teeth on either side. So you sort of need to do some sort of flossing regime to get rid of that. Because there are so many different types of flossing techniques out there, either using this kind of thin strip of floss, or you can use like a tiny proxy brush, as you mentioned before. Water picks as well, I've heard of. I've never used one of those. What's kind of the easiest one to use and someone to kind of ingrain into their daily lifestyle?
So I remember, when it was in the media, like, flossing doesn't do anything. Oh, that was fun for us all dental professionals. We were like, oh no, every single person's going to be like, why do I need a floss? So yes, like you said, the absence of evidence doesn't mean, it just means they didn't do any research on it yet, but we clearly can see it. It seems like one of those like really clear night and day type examples where there's a bunch of gunk between your teeth, and when you remove it cleans it. So it just kind of didn't seem like there needed to be too, like it's the same thing as brushing, but in between your teeth. It's the same idea. So 60%, I believe, of your dentition, 60% is cleaned through brushing. So the other 40-ish% is between your teeth, which is huge. I always say if I had a 40% off discount at the store, I'm going to use it. I wouldn't just skip out on it. So yes, traditional string floss is the best if you do it right. Again, a lot of people, there's user error. Some people have a hard time wrapping the string around their fingers and getting it in there. So if you're not doing it properly, there are alternative options. But properly, really quick, is just up and down, hugging the sides of the tooth. A lot of people saw it back and forth because you see that in movies and TV shows, and that's not right. The sawing motion gets it in where it needs to go, but once it's in, up and down to the right, up and down to the left in like a C shape. You really want to think about scraping the sides of your teeth. I feel like when I say that to people, they're like, oh, I haven't been doing that. And
it's
I'm like, oh,
cutting cheese.
There you go. We're moving the cheese from between your teeth. So but sometimes it's hard for people. Once you get the hang of it, it's great. I love traditional string floss. I think everyone should use it if they can. However, a lot of people maybe have a hard time. Those little floss picks, those little flossers where it's like the floss on a stick, on the little plastic stick or whatever, those work. They're a little harder to do like a really good job, but I'll take it. If you're not flossing at all, use the floss picks. It'll make it easier for you, and we'll go from there. Then another option are the proxy brushes. They come in a bunch of different sizes. They look like little Christmas trees, or I don't know, little baby bottle brushes, like micro brushes for a baby bottle. I don't know how else to describe it, but if you search interdental brush or proxy brush, you'll see what they look like. But they just go in between your teeth. A lot of people use them during braces because it helps clean around the wires. But more than that, it's not just cleaning around wires. It can actually go through your teeth. They make small enough sizes where it can just go where you would floss, and you just go in and out. I like those. I think they're really easy and fun. They sometimes are difficult for people who have a lot of different spacings between their teeth, because then you might need to use multiple sizes and it gets complicated. Or maybe you have a bridge, or, different types of dental restorations in your mouth where maybe you just use it around a few teeth. So I love the option of those for certain things. And then the last one, the water flossers, those are really good for anyone who has gum issues. I never recommend them for those who have cavity issues. I mean, you could use it in addition to string floss, in addition to one of those other things I mentioned, but water flossing, from what I've seen, this is very controversial in the dental field, but some people will say it replaces string floss. And again, if you're only going to water floss, I'm okay with it. Like, at least you're doing something. But if we really want to do the optimal thing you can do at home is both water flossing and string floss. String floss will help prevent against cavities and gum disease. Water floss will help stimulate the gum tissue and really make them healthy. Anyone who has any signs of gingivitis can benefit from a water flosser. I know it's not easy. That's a lot of steps. I'm asking you to brush. I'm asking you to floss. I'm asking you to water floss. I'm asking you to scrape your tongue. Some people really need to scrape their tongue. I'm asking you to eat healthy. I'm asking you to, I ask people to do way too much. So I try not to add too much, unless you're someone who's so excited to do this and you're like me, like, what can I do? I'm going to do it all. Go for it. But don't think you need to, again, unless you're told.
I think there are a lot of people who just maybe haven't had the right guidance, either through their own sort of childhood, adolescence, by dental professionals to guide them on these techniques. Listen, I'm the sort of person that if you told me these are the 5 steps you need to do to have the perfect oral hygiene routine, I would do it.
I love that.
Because actually, some of the statistics you just mentioned there, traditional brushing can hit 60% of your kind of teeth surface area, but 40% is lying between the teeth. For me, that's a bit of a wake up call to someone who's maybe not flossing, because even if you're brushing twice a day, you're just getting just over half of your oral hygiene care needs met. So why wouldn't you floss? Because to buy like the string floss, for example, that's like what, a few dollars, and that lasts you a few weeks. So for a few dollars, would you not prioritize and value your dental health, because it's going to affect your heart, your brain, your gut? So it makes sense for a few dollars to trade that in, right?
I think so. I really do. And, I don't know if every dental office gives floss away, but your dental office should give you a little floss in your goodie bag. Some of them do. And then you can use that as long as you can, right? You can go to the dollar store, discount stores. It's so inexpensive. I remember when I was in dental hygiene school, our teachers told us, if you can get your patients to floss with a shoestring, so be it. And I was like, okay. They're like, as long as they're using something to disrupt that plaque in between the teeth. Because like you said, it is, it's a large amount, and you wouldn't want to just, no matter how good your toothbrush is, it can't reach in between the teeth. You hear that popping motion, right? Like it needs to just disrupt it. I don't care how good you do. I mean, I do for someone who wants to be optimal, but for people who just want to get by, just do it real quick. Like just do something, disrupt that plaque,
You mentioned tongue scraping as well, and I guess that's something that most people haven't ever considered. And I guess, is the role of tongue scraping more to just general health and getting rid of debris from the tongue, and maybe improving the odor of your oral cavity by scraping away kind of that biofilm and bacteria that could be, your tongue is harboring?
I think it's, what is it, like 80% or 90%? All these statistics. It's a large number, 80 or 90% of the bad breath bacteria is found on your tongue. So if you have that bacteria, right, like everyone's different again. But yeah, so I'm always like, if you have bad breath and you're doing everything, you're brushing, you're flossing, you're seeing your dentist regularly and your dental hygienist for cleanings, and you still have bad breath, maybe you just need to brush your tongue or tongue scrape on your tongue, because maybe it's just gunk is stuck on your tongue. Another thing is, bad breath can be caused by a million different things. So if that's not working too, I always say, the number one cause of bad breath is not flossing, because it's the stuff stuck between your teeth. You wouldn't believe what can be stuck between your teeth, even if you didn't floss in months and you're like, I'm going to floss. Like I talked about earlier, that plaque versus tartar, it can be tartar stuck in there if you skip too many days in a row, that 24-hour window. And even if you floss, you're not going to get that stuff off. So long-term tartar is really a certain scent. So if you're struggling with bad breath, I always say, get the professional cleaning first, keep up with your dental care, the brushing and flossing. And then if you really want to, at least brush your tongue with your toothbrush or use a tongue scraper. It just really, you'll be surprised what you see come off on that tongue scraper. Of course, another thing is tonsil stones. I think that that's like trending on social media. I get so many messages on my YouTube videos like, what about tonsil stones? Everyone wants to know about tonsil stones lately. But yes, there can be stuff stuck in the back of your throat. So I always say, if on the dental front, you're all good, we're like, everything looks good for you, then of course go see your primary care physician or a specialist, to an ENT and ear, nose, throat. Try to figure out what might be going on in the back of your throat, because that's the next like step usually.
I guess, when looking at sort of dental health, when people look at someone's mouth, they're looking for pearly white teeth. And I guess that's a bit of a problem with society, because the natural color of teeth isn't white. It's sort of off-white, and it can even be like a shade of creamy yellow. That's the natural state of teeth. And we have this obsession with kind of purifying and making everything squeaky clean. And I guess, the harm in thinking that teeth are meant to be white is that people might try to kind of brush off that enamel layer by brushing too hard, by using teeth whitening DIY strips at home, and doing all sorts of cosmetic things to try and meet societal expectations, which can be harmful for health.
Yes. So I always say white teeth does not equal healthy teeth. I've seen way too many people that come in with a beautiful white smile, but then when they open, all the molars have cavities. There's gum disease. There's, it's like, hold on, there's staining on the backs of the front teeth, like when you can't see, the back sides. So just because those front teeth, the ones you see, does not mean a lot of celebrities, I've seen this where like you zoom into their photo and you're like, ooh, they have a perfectly white smile. It's, but there's gum disease. Like I see the red. So yes, don't let people fool you. White teeth is not equal healthy. And the same way, I've seen people with very stained teeth. Like maybe they just drink a lot of coffee or they just happen to have thinner enamel so that dentin, which is the yellowish tint, shows through more. Nothing wrong with that. But they have perfect teeth, not one cavity, not one sign of gum disease. So just because you have a little not as bright teeth as you want does not mean they're unhealthy. On that same note, you mentioned whitening. Yes, I'm okay with whitening in moderation here and there a couple times a year. I think you're not supposed to whiten more than 4 times a year. I think that's like, again, everyone's different, but that's the blanket statement. But if someone really wants white teeth, like I get it. I have white teeth. Like I do this for a living. Like I prefer my teeth to look white, but that does not equal health. But I do it in a safe way. It's so stressful seeing all the DIY whitening hacks on social media, because please don't do any of them. I'll just say that. If it sounds too good to be true, it probably is. If someone's telling you this is going to whiten your teeth, you've never heard of it before. No, like, don't you think we'd all be doing it so no, it's just, of course, white strips work if they're either recommended by your dental office or approved by an association. I'm all about like checking the ingredients. Hydrogen peroxide is what's going to whiten your teeth, however, or carbamide peroxide, some kind of peroxide. But however, you can overdo it. It's not good for your teeth. You're dehydrating your enamel in a sense. So like over time, they get better. But if you overdo it, you don't give your enamel time to bounce back. So I'm the wildest one I saw recently was using a lemon juice mixture to whiten your teeth. First of all, lemon juice that's one of the most acidic. Again, acidic environments, very bad. No, you're not whitening your teeth. You're just giving yourself cavities. What's another one? Like charcoal toothpaste, activated charcoal. Everyone's talking about that lately. That one's a tricky one because, it can whiten your teeth, but over time, hold on, don't turn this off. Over time, you will actually brush your teeth yellow because some of this activated charcoal, especially the at-home one, it's so abrasive and there's layers of enamel. And every time you brush away a layer, sure, the next layer is going to be really white. You're going to be like, wow, the next layer is going to be white. The next layer is going to be white until you get down to the last layer of enamel. And now you're at that next layer, dentin, which is yellow.
Yeah.
You brushed your teeth yellow. Now you're going to have sensitivity. You're going to, it increases your risk of cavities, gum disease. There's so many bad things with this charcoal. So don't even mess with it. Of course, a lot of companies now, they've seen the trend of charcoal. So they're making like black toothpaste and calling it charcoal. And when you look at the ingredients, there's not one charcoal anything in it. They just stained it black because they know it's trendy. So my point, because that's always the next question. What about the big brands that make charcoal toothpaste? I'm like, they don't even actually have charcoal in it. It's so wild. Wow. So yeah, the activated charcoal at home, no good. Lemon juice, orange peels. I've heard the weirdest things people are putting on their teeth. Don't do any of that. It's really, really bad. If you want to whiten your teeth, get normal white strips at the store, at the dentist. There's also in-office whitening if you want professional teeth whitening at your dental office. It usually takes longer to do white strips at home, right? Because it's a lower percentage of peroxide. It might take 3-4 weeks to get the results you want, whereas in office, it'll take an hour or 2. So it's really just like time is money and money is time. It depends. You're going to achieve the same results. Don't think in office is better. It just happens quicker. So if you really want white teeth, talk with your dental provider. Don't try and do stuff at home.
How often do you think people should be visiting a dental professional to get checked up, whether it's a dentist or a dental hygienist? How frequent during a year should that checkup be done?
Generally, twice a year is great for a healthy mouth, right? Twice a year. Some people can get away with once a year. I can't believe I'm saying that, but some people can. But you have to really talk with your dental provider about that. It's a very small amount, but some people can. But twice a year, you can't go wrong. My thing about the once a year people, I say, if you really want to take that chance, because here's the thing, when you're seeing us more routinely, we'll catch things when they're small. before anything. If you wait a whole year just because you can, what if there's something we could have caught and now it's so big, like a cavity or something, or just some kind of enamel, something, decalcification. So I'm all about twice a year. When you have gum disease, they generally recommend you do 3 times a year or 4 times a year, especially after a deep cleaning or SRP, a scaling and root planing, when they've cleaned. If you think of it as you just have more tooth surface that's needs to be cleaned because you have these perio pockets. You have this gum disease where we go so deep into the gums, we have more, tooth surface exposed. So we need to clean that up more frequently. Sometimes I have some people who need to do that for life. If you have really severe gum disease, every 3 months. So what is that? 4 times a year. Whereas some people can graduate to 6 months one day, right? Like, okay, I graduated. I'm only twice a year now. I'm going to stay there. So again, it just depends, but at least twice a year is really, really ideal.
What is Whitney's dental routine?
No, well, that's fun to ask. So I do have a bunch of videos online, like my morning routine, my evening routine, and they change a lot. So if through the years, you'll see. Having said that, they change with the products I'm using, but it's all the same. I brush first and I floss second. That always surprises people because a lot of people like to floss first and brush second. Fun fact, it doesn't matter the order as long as you're doing both and you're using proper technique. So that's what I do. I brush and floss. In the morning, I tongue scrape. I try to brush after every meal. I really do. That's wild. I don't expect anyone to do that. I bring a toothbrush in my purse at all times. Like when I go to events, I don't expect you to go to a party and bring a toothbrush, right? But I do because I just kind of dedicated my whole life to this. So I try to keep up with it. But you don't have to do that. But then at night, that's where it comes. That's my big routine is at night where I add all the extra stuff. I do my brushing. I do my flossing. I'll use a water flosser here and there. I'll use some proxy brushes on my lower front teeth. These bottom front teeth are where most people build up tartar and plaque. Almost everyone, because your salivary glands are right under there, under your tongue. And there's just so many reasons why there. So I'm always on it. Those lower front teeth, I'll do an extra 30 seconds of brushing on my lower front teeth just because I know that's a spot for me and most people. I gargle lately with warm salt water a lot. I think it's really nice for my throat because I was a tonsil stone person in the past, so I'm trying to prevent that from ever happening again. I like an anti-cavity mouthwash. I was always more cavity prone, so some people argue over keeping the toothpaste on their teeth. So you brush, you spit, and you don't rinse. There's no research to say either way. Like people feel so strongly about this one. It always makes me giggle because I'm like, well, this is definitely anecdotal. And if it works for you, great. But there's nothing to suggest that that's like better. Using a mouthwash with anti-cavity is just as good. Like I have a texture issue. I do not want toothpaste sitting on my teeth. Like, ooh, but some people don't mind it. If you can, sure. Yeah, there's more fluoride in toothpaste than the mouthwash. But there are prescription strength toothpaste that you might be prescribed that you need to do that with. Sure. There's reasons to do it. But for me, I love a mouthwash. I like slick, clean teeth when I go to sleep. I wear a night guard every single night because I'm not playing around with clenching and grinding. I've seen way too many people wake up with a broken tooth. They call us in a panic in the morning. I need to come in. I woke up and my tooth is chipped because this clenching and grinding is a problem. We're a stressed out world right now and always. Yeah. So if you're clenching and grinding and your jaw ever hurts you in the morning, it's wild what a night guard can do to protect your teeth. You much rather bite and break a night guard than bite and break your teeth, right? Because it's much easier to replace a piece of plastic. So yeah, that's kind of my routine. I don't eat that healthy. I'm going to be honest. I mean, I eat healthy, but I'm not like a health freak. Like, right? I make sure I do my fruits, my vegetables. I do all my stuff, but I like what do they always say? Like dentists and dental hygienists you're eating sweets. Like I like my ice cream. It's okay to have a nice life and enjoy yourself as long as you do not skip your brushing and flossing at night. Don't let that ice cream or those sweets or honestly fermentable carbs, any kind of bread, crackers, cereal, chips, that's even worse for your teeth than candy because it gets stuck in all the crevices. And as we know, right, it breaks down into carbohydrates, break down into sugars, and sometimes it breaks down in your mouth. So we do not like breads. I think those are more stressful than candy, honestly. So I just make sure you brush. No matter what you eat, make sure you brush. Of course, a healthy diet is very helpful for dental health as well. But we take one step at a time. All we can do is the best we can. I hate stressing people out about it.
I feel that what you've been able to do in this episode is at least highlight how important dental health is, not just for your mouth, but the rest of the body, and also how easy it is to prevent problems down the line by just doing very simple things now. Like, if someone wanted to get a six pack or get bigger biceps, that's several weeks, months of effort in the gym, and it's a lot of input. But with dental health, to get really huge outputs, the input is actually very small. It's an extra 5 minutes in the morning to focus on, your brushing, your flossing, and scraping your tongue. So, thank you for coming on and giving those science-based, evidence-based tips on how to improve oral health. And, I think we've just scratched the surface. There's so much we could talk about, and you need to come back for part 2, I think.
Thank you. Yes, there's so much misinformation out there. We can go for hours and hours talking about all the things people are doing. But thank you for having me and spreading the word. I love everything you're doing with everything health, right? And so it's just so cool to be able to kind of help people make better choices with their health.
Thanks again to Whitney DiFoggio. What oral hygiene problems are you struggling with at the moment, and has this episode cleared up anything for you? Let me know in the comments below, and make sure you subscribe so you don't miss the weekly Dr. Karan Explores podcast, and I'll see you and your pearly white gnashers next week.